Thank you. And that was such a lovely video. I don't know how many of you were actually listening to the words of the song playing in the background, but to hear that coming out of the dark really does speak a lot about what this organization is about. A lot of people have asked me to tell the story of the case with Michael J. Woods, James Woods' brother. Many times asking things like, what was the strategy that you used to arrive at the settlement of that case? How did the lawyers advise you in the process? Who was in the room when you discussed it? How did you come to the conclusion to say, I'm sorry? And every time those questions are asked of me, I look and stare back blankly. Because I was a new CEO, I had been a CEO for just about 1 year, and I had learned a very valuable lesson that probably many other CEOs in this room understand. When someone goes through the list of malpractice cases that are open, I needed to learn to pay a little bit more attention. Because somebody had mentioned that James Woods was suing us, but there was nothing more to it than that. James and his family grew up in our town, so that was not an unusual thing, and I didn't understand the significance. Then the case came and it went to trial, and along with Entertainment Tonight and all of our major news outlets and the news outlets around the country, following the case and following what happened to Michael in our emergency room. I went to the court one day and I listened. Now, your lawyers will advise you that the CEO shouldn't go to the court, but it was a very informative day for me because I learned and found out that we hadn't done everything correctly. We had had a system failure. We had not followed a physician's order. So when the day came that we were finally trying to settle the case, and quite honestly, many people wanted us to settle it, the public relations staff in particular were not enjoying the process. It was concerning to me because how could you settle something when you had been such a difficult story in the public and had not even put out a defense? And I remember saying to someone, the only way I could ever settle this case is if Jimmy would stand with me and agree to change this hospital for the better. If we could combine our efforts and take the pain that he and his family endured and join it with us to improve the care to patients going forward, then we could settle. So we asked if he would meet with us, and I met with him. And that's where really all the headlines come. You know, she said she was sorry. Quite honestly, I did nothing other than what my mother taught me. I think all too often in healthcare, we evaluate and we are counseled and we read books upon books. But sometimes you just have to go back to your core value. I faced a man who had lost his brother, a brother he had raised in absence of a father, a brother who cared for an elderly mother while he was out doing his career, someone who was very dear and close to his heart. When I met that man, I did not meet James Woods. I met a family member who had lost a brother because an order that was written by our emergency physician was not carried out by the staff. We did settle the case, and we established the Michael J. Woods Institute. And the purpose of the Institute is to redesign healthcare from a human factors perspective. Some of you in the room are trained in Lean. Some of you are trained in Six Sigma, and those are all wonderful tools. But what happened in our emergency department was the combination of the process and the human fallibility and the design of the space all conspired to create that failure. And that's the perspective that we all agreed to do. So I can't tell you how to say you're sorry. I can just tell you to do what feels right in your heart, because that's what that moment was about. There was one thing, though, when James and I started to talk, he very nicely looked at me and said, either you are a better actress than I am an actor, or I'm going to be coming after you. Because the words, I'm sorry, and can we put this behind and work forward, is meaningless if you do nothing with it. They're not words to be stated lightly. They are words that are meant to create change. So I was fortunate because I'm not as good an actress as he is an actor, which meant that I meant what I was saying. And we have made dramatic change in our emergency department, and hopefully in the future through the rest of our hospital. We have been able to eliminate waiting. We have dropped our time from the arrival in the door, waiting from about 2 hours to see a physician to an average of 30 minutes. We've actually eliminated half of our waiting room. Our overall time in the emergency department has dropped by 2 hours. All of those efforts were important in terms of following up, of making the difference. But there was an aspect to this settlement that I think this organization in particular is probably very interested in, is that there were staff involved in this case, of course, and those staff had been dragged through the media just as well as the hospital had. The night I settled the case, after we left the courthouse, I went back to the emergency department and spoke to the nurses that had cared for Michael. They were devastated because their reputation had been damaged. This was not a case of them feeling they had done anything wrong. I think they understood at the time that it was a system error and no one held that individual accountability, but their reputations had been damaged. Our physician who cared for Michael now practices in a college clinic in Rhode Island. She's no longer in the emergency department and no longer practicing medicine outside of that clinic. It's something that really weighs heavily on my heart when I think about that. My mother asked me in preparation of coming here, she said, you know, it's really great that you did that with Michael and James's family. What about the doctor? And quite honestly, I don't think I did enough for that doctor. She still suffers, just as those individuals and the nurses that are still with us do. And as you look back on it, I think it's important as we deal with these situations that we really have to think about all the participants. One of the parts, though, that I think is most important that we've learned is that when you're talking about letting people heal and recover and not feel the blame of an error, because there was an error. I was not going to say that there was not. It did occur. There's no denying that. But how an organization deals with an employee or staff member when an error occurs, we like to say that they're treated fairly, that we're evaluating the system. But if you only do that after the event, if you only do that in the case of serious negative outcomes, you have failed your staff. You must evaluate all situations that don't go as planned in a fair and just way. So on October 1st of this year, Kent Hospital gathered all of its disciplinary policies. It gathered all of the forms that we do employee counseling with and shredded them all. We have adopted the just culture completely. So we look now to our employees based upon the event, upon the duty that they had violated if that occurred, and on their own individual behavior within that. So if an employee arrives late to work, they will be treated the same way as an employee who makes a medication error. It applies to all aspects of their performance, and that allows us to create the environment where if there's something goes as not planned, if there's no negative outcome, nothing has happened, but it could have. It's our drunk driver who doesn't cause a fatality gets a moderate sentence, and the one who does is in prison. Not at Kent Hospital. It is the act that will bring the consequence if it was reckless, not the outcome. And to me, that is the very best way to support our employees, because if they see that happen before they experience a negative outcome, then you have built the trust and the faith and the confidence that, in fact, it is the behavior, it's the duties that we carry to work that will be the difference. And that, to me, is what makes the staff open and comfortable to deal with situations, because we can't avoid them. We have to come out of the dark. We have to acknowledge our mistakes when they happen. But we also have to treat people fairly. And that ranges from the family through the caregivers to the organization. We all suffer in this process, and we all have to stand together as we face it. I am honored to be able to tell you that I've got the support of James Woods, of our malpractice attorney, Mark Dekoff, who participate in the Michael J. Woods Institute to make Kent Hospital better. We look forward to other organizations doing the same thing. It's been a tremendous opportunity, but quite honestly, one that only required the courage to do what was right. It did not require a strategy. It did not require a group of lawyers. It just required your mom, your values, and the commitment to follow through on what you know you need to do. So with that, I'm going to turn you to your salad and let you enjoy your dinner. Thank you very much.